My name is Dr. Matta. I'm a cosmetic physician in the Toronto area, and I've been doing cosmetic medicine for about 10-12 years now. Majority of patients are looking for abdominal treatment to help with what we call mummy tummy. So once they've had children and the skin is a bit loose, a little bit of extra fat in that area, they want to tighten that up. So probably the abdomen is the most common. The other is cellulite treatment around the thighs, either the outside thigh or the medial thigh, the inner thigh. And the last one probably would be around the pre-jowl sulcus, which is what most people know of as the jowls. So it gives a little bit of a lift in that whole lower face area. No, that's the thing that's really nice about the Maximus. So it is a thermal treatment, so it does heat up the skin and heat up the subcutaneous tissue. But it's done very slowly, which is very comfortable. A lot of patients feel it's almost like a little massage, and they feel quite relaxed while they're having the procedure done. The abdominal treatment, when we use the DMA or dynamic muscle activation, can have a little twitchiness to it, so it can be a little bit zippy for people, but especially if you're really well hydrated, the majority of people find it completely comfortable. Well, the majority will say, wow, I can't believe that they're hurt, because as I said, a lot of people are expecting treatments to hurt. And nowadays, people really don't want pain. We don't want to make people feel uncomfortable that they don't want to repeat the treatment or recommend it to a friend. So the majority will comment on how comfortable it is. There will be people that will comment right away. They notice a difference immediately after. We've had patients that will say, you know what, wow, I can't believe it. Within the first couple of hours, they even see a difference. Obviously, those are short-term results, and then with time, over the next couple of days to weeks, they would become a more continued response. So they will notice an improvement, again, either in that jowl area or a little bit of tightening in the belly area. We've had patients with the cellulite treatment that have had fantastic results even after 5 or so treatments. 3-4 months later, their cellulite still looks at least 40, 50, 60% better than what they started with, which is excellent for cellulite. Mm. If we're talking about the facial treatment with the Maximus, there are a couple of different areas that can be treated. One is the vector along the cheek to try and give some lift, and the other is the lower half of the face. Now, as an injector, a lot of times I will do the top part of the face with fillers or combine it with some toxin treatment. The really stubborn treatment, and that's why I like the skin tightening procedure so much, is the lower aspect of the face. So that pre-jowl sulcus, what we call the submental region, which is that little waddle under the chin, we can't do anything with fillers. We can't do anything with toxin treatment. So the skin tightening treatments, the Maximus kind of treatment with the radiofrequency, is one of the few options we have to tighten that area up. So it's a really nice procedure that I have to offer for them. And considering that it's a fairly simple, relatively pain-free treatment, patients are very pleased with the results. Now, there will be some patients that are expecting a dramatic difference, within a couple of days, and they, as I said, will get a short-term benefit. But to really get the long-term benefit of the radiofrequency treatment, it is a period of months to get that full effect because of the collagen remodeling and skin tightening that occurs. Well, the thing that I like the most about the Maximus is always a subject of discussion between me and my esthetician. She likes the DMA, which is the dynamic muscle activation, because she really likes to use on the abdomen to contribute to that tightening and to help basically pump out that fat a little bit on the abdomen. I really like the fact that I can get up to a high temperature with the Maximus, which is really nice, because there are other devices that are potentially available, but they won't be able to get me up to the temperature I want to. And to really get an effect on some people, I need to get the temperature up to 43, 44 degrees Celsius, and I see much nicer results when I get up to that temperature. The other thing that we really like is the ability to use the machine to contour in specific areas where we can really work at specific angles to get the exact result we want. Smaller handpiece we generally use for delicate areas and periorbital areas, around the eyes especially, to try and do a little bit of lifting up in this area and underneath the eye. Mm-hmm. Because again, the under eye area is a stubborn one. Even with the injectable options, we really can't achieve a lot in that area. So the radio frequency treatment is a nice option. I really like the TriFractional. It is the additional piece to the TriLipo machine, and I use it mostly now for stretch marks and for scarring, whether it's acneic scarring or surgical scars or traumatic scars. And it's funny because I've actually had patients who've had almost every option I have available for stretch marks, whether it be trying a novel approach with fillers, whether it's trying laser, whether it's trying, you know, other kinds of radio frequency, and they noticed actually that the TriFractional gave them the best results out of any treatment they use for stretch marks. So it's very nice for stretch mark and very nice for acne scars. Any area where you've got a scar, I do it on stretch marks on the belly, I do it on surgical scars of the body, the thyroid, I'll do it on the face. We do temporal lobe treatment, whole frontal treatment, and anywhere where there's an issue to be addressed, we address it.
With the TriFractional?
We can. I am in an area where there is a significant number of darker clients, and I am dark to begin with, so I'm especially sensitive to treating the darker skin. And I was always concerned, even with the TriFractional, to make sure that was safe for my dark skin patients. And I have lasers, I have IPL, I have all the other modalities to treat. And really, I try not to use them on dark skin because there's always the risk of hyperpigmentation. I have been very successful with the TriFractional on the low setting, which is a very reasonable and fair setting to achieve results, and I've had no issues with hyperpigmentation, no issues with any significant downtime. Patients are pleased, and it's been a nice additional treatment for my brown patients. The TriFractional and the Maximus were an excellent addition to my practice. They were able to provide a very good return on investment. When we brought it in and introduced it to patients, it was a very welcome addition because, again, as I said, my practice at the time was principally injectable. And for that lower aspect of the face and for body contouring and body treatments such as cellulite and abdominal laxity, I really didn't have anything significant to offer at that time. So we had a fantastic return on investment with the Maximus. I mean, I have wonderful results with that. It's been a great addition to my practice.